Good evening, guys. The topic that I'm going to take today is HPV vaccination. We will study something about HPV vaccination. Then we'll take an article from the Hindu newspaper, a shot at life Mandsaur's model for HPV vaccination. The newspaper date is of 3rd July 2026. See, on 28th February 2026, Prime Minister Narendra Modi inaugurated the campaign from Rajasthan. The primary objective was prevent serious and life threatening diseases such as cervical cancer by providing vaccine to 14-year-old girls. Now, states such as Madhya Pradesh, Andhra Pradesh, Tamil Nadu, Gujarat, Odisha, Mizoram, they have witnessed highest vaccination coverage. What is HPV now? HPV in India, cervical cancer is the second most common cancer among women. And India accounts for nearly one-fifth of the total burden of cervical cancer. One-fifth of total burden. See, HPV is a common sexually transmitted infection with multiple types. Sexually transmitted infection with multiple types. In most cases, the body's immune system clears the infection within 2 years. This infection persists and leads to abnormal cellular changes that may eventually develop into cancer. It does not affect only women, it can also cause genital warts, anal cancer, penile cancer, and cancers of throat and mouth in men also. So recent studies they have shown that 1 in 3 men above the age of 15 is infected with some form of HPV. Now, to address this challenge, India's vaccination strategy. Government of India has planned free vaccination targeting 14-year-old girls. Girls are not sexually active at this stage, and vaccination at this age provides more effective and long-lasting immunity. Government is using UWin digital platform developed on the lines of COVID platform used during COVID-19 pandemic. This will ensure monitoring, registration, and transparency in the vaccination process. Currently, government is using Gardasil vaccine, which provides protection against four major types of HPVs: 6, 11, 16, 18. In indigenous vaccine Servavac, developed by Serum Institute of India, is likely to be included. It helps reduce costs, promote self-reliance. WHO has set a target to eliminate cervical cancer as a public health problem by 2030. And for this, vaccinating 90% of girls before the age of 15 is considered essential. Now, several developed countries such as Australia, United Kingdom, United States, Canada, Germany have adopted gender neutral HPV vaccination policies by including boys as well. In this, Australia has been the global leader. What is the importance of vaccination? It is a socio-economic investment. Disease prevention. The vaccine, it eliminates the root cause of infection, the risk of cancer. And in Sweden, a study was conducted, found that women vaccinated before the age of 17 had up to an 88% lower risk of cervical cancer. Economic benefits. Cancer treatment, it imposes a heavy financial burden on both families and healthcare system. Vaccination can substantially reduce this burden. Gender equality and social impact. Improving women's health has a direct impact on overall development of families and society. See, healthy women are more productive and contribute significantly to social progress. Herd community. Herd immunity. When a large proportion of population is vaccinated, the spread of infection declines. So it indirectly protects men and other groups as well. What are the challenges? Awareness and myths, because there are many misconceptions in society regarding HPV and its vaccines. Many people associated with sexual behavior, leading to hesitation in vaccination. Need for gender neutral vaccination. This program focuses only on girls, whereas scientific evidence shows that men can be both carriers and victims of the infection. So, in long term, even boys should be included. Uncertainty regarding indigenous vaccines. See, Servavac is a significant achievement. It has been recognized globally and effectiveness is still ongoing. So it needs clarity before its widespread use. Then health infrastructure and implementation. See, limited healthcare access and low digital literacy in rural and remote areas may hinder effective implementation of the campaign. What is the way forward? India must develop this initiative into a comprehensive health strategy. Comprehensive health strategy. Promote regular screening for cervical cancer. Expand outreach to adolescent girls through school based health programs, conduct awareness campaigns, to eliminate myths and misconceptions, adopt a gender neutral vaccination policy in future research and development. Then let's look at this article. The article says a shot at life, Mandsaur's model for HPV vaccination. Written by Aditi Garg, ma'am. So they've actually taken a case study in a district Mandsaur, Madhya Pradesh. Because of low level of awareness and social stigma, Government of India, as we know, had launched a nationwide cervical cancer campaign on February 28, 2026. So, to implement this program effectively, the Mandsaur district administration adopted a data driven decentralized and adaptive strategy. Girls from difficult to reach communities, nomadic tribes, urban slums, and school dropouts became the starting point. Difficult to reach communities. So, at grassroots level, the challenge is not vaccine hesitancy but data invisibility. Multiple government databases such as RBSK, that is Rashtriya Bal Swasth Karyakram, then Samagra MP, a citizen-centric social security platform by government of Madhya Pradesh. Then Ladli Lakshmi Yojana. These target lists were created. Fragmented records were transformed into actionable intelligence. Records into actionable intelligence. Reducing barriers through nudges. So the district relied on nudge approach that helped design an environment where vaccination became the default choice. This helped in breaking down grassroots barriers such as reluctance, inertia, social discomfort. Healthcare workers informed families that their daughters were due for vaccination rather than asking them to choose to vaccinate. Schools and local bodies arranged transportation to eliminate logistical barriers, simplifying the access. Social norms and peer networks served as powerful behavioral nudges. Local events publicly felicitated vaccinated families and recognized vaccinated girls as peer champions. Digital nudges and red flag reminders for frontline workers enhance monitoring and accountability. Strategy to impact. So HPV campaign was integrated with ongoing healthcare programs. प्रधानमंत्री सुरक्षित मातृत्व Abhiyan sessions were used to promote HPV awareness and conduct vaccination drives. So, when women assessed one service, they became more receptive to another, creating avenues for bundling of health care service delivery. Bundling. The results were significant, and in less than 40 days, Mandsaur achieved 100% of its vaccination target. 493 vaccination sessions were conducted through 12 permanent and 27 temporary vaccination sites across the district. So, healthcare challenge must be met with the measure of its grassroots actions. Behavioral and systematic nudges in implementation can leverage the human tendency to opt for preset choices. So, by moving from coverage to care, from data to impact, Mandsaur turned a formidable public health challenge into a collective mass movement. Collective mass movement. Health challenge. Public हेल्थ चैलेंज को एक कलेक्टिव मास मूवमेंट में कन्वर्ट कर दिया. This district's inclusive vaccination campaign demonstrated how a simple shot in the arm can truly become a fair shot at life. That's it. Thank you.